Thank you for joining us for the St. Louis Metropolitan Pandemic Task Force daily briefing with Dr. Alex Garza. The briefing will begin momentarily. We will take questions submitted by members of the media after making brief remarks. I'll now turn it over to Dr. Alex Garza.
Okay, good afternoon, and thank you everybody for tuning in to today's briefing. Before we begin our regular report on our hospital data today, I'd like to spend a few minutes talking about some exciting developments related to COVID vaccines. So, as you may have heard, Pfizer submitted their results for their vaccine clinical trial in that 12 to 15-year-old age group to the FDA a couple of weeks ago. Now, the Pfizer vaccine was already approved, as I think everybody knows, for anybody 16 years of age and older. Now, we expect that the FDA will decide early next week on whether to extend that authorization for the vaccine to this younger age group, and I think everything that we have seen says that they will. Now, we know from the data submitted to the FDA that more than 2,000 adolescents participated in the trial, and none of the participants who got vaccine were infected with COVID during the trial, which means that the vaccine had 100% effectiveness in this group. Now, this is really encouraging news. The vaccines would not only protect these kids from getting sick with COVID-19, but would also prevent them from becoming infected and then spreading COVID to other people, such as parents, grandparents, teachers, and others that are still not vaccinated. Now, if the vaccine is authorized, we'll share more news about that and what parents and teenagers need to know about getting vaccinated in next week's briefing. Now, in addition, you may have also heard that Canada today announced that they have already approved it today, the Pfizer vaccine for persons 12 to 15 years old. And this is, again, just more exciting new development that gets us closer to getting out of the pandemic and back to normal. So with that, let's take a look at where we are with vaccine distribution. So again, this is Region C. This is the Highway Patrol region that the St. Louis metropolitan area falls in. To date, at a minimum, we've delivered almost 1.5 million doses of COVID vaccine. Now, the majority of those, around 900,000, are first doses, and then around 650,000 second doses. Now, we say this is at a minimum because we know that there's always a data lag getting into the Show Me Vax data set. And it also doesn't include vaccines from our federal partners, whether that's with FEMA or with the VA system, places like that. And so at a minimum, these are our numbers. Now, I think as everybody knows, or as I just said, all Missourians 16 years of age and older are now eligible for the COVID-19 vaccine. And now there's more options than ever on how you can get vaccinated, including the one-shot Johnson & Johnson vaccine. Now, there continues to be many mass vaccination events planned in the coming days and weeks in our region, as well as the FEMA site down at the Dome, which continues. Now, I visited the Dome last week, and there was literally no waiting to get vaccinated. The process was incredibly smooth, and they had plenty of vaccine on hand. And if you're one of those people that had to travel outside of the metropolitan area to get your first dose, and you're scheduled for that second dose, you don't have to travel outside of the metro area. You can just come down to the Dome, and they will deliver the dose for you, as well as many other places within the metro area. So again, you don't have to travel out of town to get that second dose. Now, you can find details and links to register at covidvaccine.mo.gov/events. Again, that's covidvaccine.mo.gov/events. Now, in addition to all those large events, you can also find vaccine through your healthcare provider, through local public health departments, local pharmacies, and through the new vaccines.gov website. So the sooner everybody starts to get vaccinated, the sooner you'll be protected from COVID and can get back to your normal activities without worrying about getting sick. Okay, so let's shift gears now to our hospitalization data. And again, we'll start off with our hospital admissions. Today we're reporting 34 admissions, and again, it's delayed for 2 days. And our 7-day average now is at 36. So it's come down slightly, which is good news. We'll take it. And today we're reporting 198 patients hospitalized with confirmed COVID-19. And that's the first time we've broken underneath 200 for a little while. Our moving average is now at 206 patients. We've still, maintained this level of around 200 patients. And in order to really bring those down further, we just need to keep up with those vaccination pace, keep up those public health measures so we can prevent spread and any new infections from occurring. A little bit more detail on our numbers now. So again, we had 198 patients hospitalized with confirmed COVID, 59 patients in our intensive care units, and 20 confirmed COVID patients on ventilators today. Of our suspected COVID patients, we have 28 patients hospitalized that we suspect have COVID, 6 in our intensive care units, and 2 on ventilators. Our good news slide: since last April, we've discharged a total of 21,815 patients and added 40 more that were discharged yesterday. Some more good news. Today we're reporting there were no COVID deaths within task force hospitals yesterday. Our 7-day moving average is at 3, so always good to put a 0 up on that graph. Just now talking a little bit about what we're seeing with hospitalizations and the different patients that are now coming into our hospitals. So if you turned into our live briefing a couple of weeks ago, you heard physicians talking about COVID patients in our hospitals and about what they're seeing and how things have changed. Now, in the beginning of the pandemic, I think as everybody knows, we were seeing much older patients and people with underlying chronic health conditions. But now what we're seeing is younger patients who are still getting very sick from COVID. And you can follow the change on this graph, and apologize it's not big enough for everybody to see, but we'll be posting these. Now the top part is a yellow portion, which represents patients that are under 45 years of age. And the green portion represents those that are 45 to 64. So you can see how these two groups of the younger population now are dominating the patient population in our hospitals. And they make up around 2/3 of the people that are admitted to our hospitals. And many of these patients are going to be dealing with long-term impacts from COVID after they leave the hospital. So if someone tells you you don't need to worry about, contracting COVID because you're young and healthy, they're quite simply wrong. No matter what your age is, you should continue to take the virus seriously, take steps to protect yourself and your family, and get vaccinated as soon as you can. Now, if you're concerned about things like you feel like the vaccine was rushed, it wasn't. It went through all of the appropriate clinical safety and efficacy trials that any vaccine would go through to get approved by the FDA. The only difference with this and other vaccines is the government invested in production early on. So once it did gain approval, we could start vaccinating quickly. So that really is the only difference there. Okay, moving on to some of our modeling slides. Apologize. Our cases or our hospitalizations are following well with our model. It's trending a little bit above that. So again, we won't know sort of which curve we're on because we're learning more about how much of the variant is in the community, things like that. It's trending a little bit above our model, so we're going to keep an eye on that. And then our ICU status, again, is trending a little bit above our best guess. I shouldn't say normal. It's really above our best guess. Looking at our epi curves across the metropolitan area, really not a whole lot of change. We're still remaining pretty flat across the metropolitan area. So again, it hasn't come down, but it hasn't gone up. So we're just sort of treading water right now. Look at our report card. Again, we're seeing that we're still in the green when it comes to bed capacity, so around 5% of our COVID and patients under investigation, and around 9% for our ICU capacity. Now that number is crept up a little bit, and we're getting closer to that yellow area where it's above that 10% mark, and so hopefully we can get that number down. Looking at our new admissions, we've already described this, sitting around 36. again, would love to see that number come down too, where we're stalled out for the last 2 months. Our prevalence of new cases is holding steady at around 2 per 1,000, so no big changes there. I feel like a broken record, would love to see this number come down as well. And our weekly change is in the yellow area around 1.5%, and that's due to some increases here recently. Lastly, our positivity rate is sitting around 8%. And this is for healthcare systems only. Has come down from that 10%, so that's good. So hopefully it will continue to come down. And then lastly, our reproductive number that we talked about last week, we're sitting around 0.97. We'd really like for that to come down even further as well. Get us down below that 0.9 mark would be great. Okay, so before we close today, I'd like to share with you that next week is National Healthcare Week. And because of this, there's going to be a community moment of silence on Monday, May 10th at 10 a.m. to recognize healthcare workers, first responders, essential workers, and others that have really supported our communities throughout the pandemic over the past year. Now, many of these people have gotten sick or even lost their lives because of this work. So please mark your calendars to join us, either from your home, from your workplace, or from your classroom, in a moment of silence for these heroic community members on Monday morning. And so with that, it concludes our update for today. We'll take any questions that we have from the media.
What have task force vaccinators seen in recent weeks in terms of demand for the COVID-19 vaccine?
Well, I think it's no secret that we've seen a drop in demand for vaccine. I think part of it is we have seen this decrease in cases and decreases in hospitalizations since the beginning of the year. The weather is getting warmer, and it's getting. We've already sort of vaccinated the low-hanging fruit, so people that were willing to get vaccinated. So now it's going to take a little bit of a different approach to overcome the hesitancy or to make it more convenient, and any of these other things that we can do to really push that final mile of vaccinations.
As the vaccines continue to roll out, among the vaccinators in the task force, is the model beginning to shift away from large-scale vaccination sites? Mm-hmm. And if so, why?
Yeah, I think so. So the large-scale sites, I think, were appropriate when we had a large demand out there. So large numbers of people could come to those sites, get vaccinated relatively efficiently, and we could get those large groups taken care of. So, but now it's I think more of getting out into the community. So whether that's with community groups or church groups or schools or businesses, things like that. So rather than people coming to the vaccine goes to the people. There's a little bit of a challenge with that, at least with the healthcare systems and others that have the Pfizer vaccine because of the logistics involved, the refrigeration, things like that. We don't want to waste any doses. But certainly we're looking at a couple of things. We're going to be pulling together a group of folks within the task force to think about, what sort of messaging do we need to be doing, who needs to be delivering that message, what is the message, and then how can we partner with as many people as we can to get as much vaccine out into the community as possible. And so we're going to be discussing this over the next week or so to try and come up with that strategy.
That concludes our list of questions. Thanks for watching.